Welcome to our exploration of generalized anxiety disorder, commonly known as GAD. Imagine living in a state of constant worry, where your mind never seems to rest, where everyday situations feel overwhelming, and where a sense of impending doom follows you like a shadow. This is the reality for millions of people worldwide living with generalized anxiety disorder. In the next 12 minutes, we'll dive deep into understanding this common, yet often misunderstood condition. We'll explore what GAD really is, how it differs from normal anxiety, its symptoms and causes, and most importantly, the various approaches to managing and treating it. Whether you're personally affected by anxiety, know someone who is, or simply want to expand your knowledge, this video aims to provide valuable insights into GAD. What is generalized anxiety disorder? Generalized anxiety disorder is more than just feeling stressed or worried occasionally. It's a chronic condition characterized by persistent, excessive worry about various aspects of life. Unlike normal anxiety, which comes and goes in response to specific stressors, GAD involves long-lasting anxiety that isn't easily attributed to a particular cause. People with GAD find themselves worrying about multiple areas of their lives: health, work, relationships, finances, and even minor matters like household chores or being late for appointments. This worry is difficult to control and often disproportionate to the actual likelihood or impact of the feared events. What makes GAD particularly challenging is its persistence. The diagnostic criteria typically require symptoms to be present for at least 6 months. This isn't a temporary bout of stress. It's a prolonged state of excessive worry that significantly impacts daily functioning and quality of life. It's important to note that GAD is distinct from other anxiety disorders such as panic disorder, social anxiety disorder, or specific phobias, though some symptoms may overlap and individuals can experience multiple anxiety disorders simultaneously. Prevalence and demographics: 3 to 430. Generalized anxiety disorder affects approximately 3.1% of the adult population globally in any given year, making it one of the most common mental health conditions. In the United States alone, an estimated 6.8 million adults suffer from GAD, with women being twice as likely to be affected as men. GAD can develop at any point in life, but it most commonly begins during adolescence or early adulthood. However, it's not uncommon for symptoms to emerge in childhood or later in life. The condition often develops gradually, with many people unable to identify a specific trigger or onset. Interestingly, the prevalence of GAD varies across different cultures and countries, suggesting that both genetic and environmental factors play significant roles in its development. Research also indicates that GAD frequently co-occurs with other conditions, particularly depression, with comorbidity rates as high as 60%. Despite its prevalence, GAD remains underdiagnosed and undertreated, with many sufferers never seeking professional help or receiving appropriate treatment. This gap in care highlights the importance of raising awareness about the condition and reducing the stigma associated with mental health issues. Symptoms and signs. Recognizing GAD requires understanding its multifaceted symptoms, which affect both mind and body. Psychologically, persistent worry and difficulty controlling these worries are the hallmarks of GAD. This worry often shifts from one concern to another, creating a constant background of anxiety. People with GAD frequently report feeling on edge, restless, or keyed up. They may have difficulty concentrating or experience their mind going blank due to worry. Irritability is another common psychological symptom. The constant state of tension can leave individuals with a short fuse. Physically, GAD manifests in various ways. Muscle tension is particularly common, often resulting in soreness, aches, or even tension headaches. Sleep disturbances are another frequent complaint, with difficulty falling asleep, staying asleep, or experiencing restless, unsatisfying sleep. Fatigue is a double-edged symptom. Anxiety is exhausting in itself, and the sleep problems associated with GAD further compound this tiredness. Other physical symptoms may include restlessness, gastrointestinal issues like stomach pain or nausea, excessive sweating, and an increased heart rate. Children and adolescents with GAD may show different symptoms than adults. They often worry excessively about their performance in school or sports, catastrophize ordinary situations, and seek constant approval or reassurance. They may also be perfectionistic and show physical symptoms like stomach aches or headaches without apparent medical cause. The severity of these symptoms can fluctuate over time, often worsening during periods of stress. Even when symptoms are milder, the chronic nature of GAD means that individuals rarely experience complete freedom from anxiety. Causes and risk factors. The development of generalized anxiety disorder involves a complex interplay of biological, psychological, and environmental factors. No single cause has been identified, but rather a combination of influences contributes to its onset. Genetically, GAD shows moderate heritability, with first-degree relatives of those with the disorder having a higher risk of developing it themselves. Research points to variations in genes related to neurotransmitters like serotonin, dopamine, and GABA playing potential roles. Brain chemistry and structure also contribute to GAD. Neuroimaging studies have shown differences in areas that regulate emotions and process threats, particularly the amygdala and prefrontal cortex. Imbalances in neurotransmitters that regulate mood and stress responses are also implicated. Psychologically, certain personality traits may predispose individuals to GAD. Those with high neuroticism, a tendency toward negative emotions, and behavioral inhibition, a temperamental trait characterized by shyness and withdrawal in novel situations, appear more vulnerable. Environmental factors can trigger or exacerbate GAD in susceptible individuals. Traumatic experiences, particularly in childhood, significant life changes, chronic medical conditions, and substance use can all contribute to the development of this disorder. Additionally, learned responses play a role. Children may develop anxious patterns by observing anxious parents or caregivers, a concept known as social learning. Maladaptive coping strategies and negative thinking patterns can also reinforce and maintain anxiety over time. Diagnosis and assessment. Diagnosing generalized anxiety disorder involves a comprehensive evaluation that typically begins with a primary care physician ruling out physical conditions that might mimic anxiety symptoms. Conditions like thyroid disorders, cardiac problems, or certain medication side effects can produce anxiety-like symptoms. Once medical causes are excluded, mental health professionals use clinical interviews and standardized assessment tools to evaluate symptoms. The Diagnostic and Statistical Manual of Mental Disorders, DSM-5, provides specific criteria for GAD diagnosis, including excessive anxiety occurring more days than not for at least 6 months, difficulty controlling worry, and experiencing at least 3 physical or cognitive symptoms. Clinicians may use questionnaires like the Generalized Anxiety Disorder 7-item scale, GAD-7, or the Hamilton Anxiety Rating Scale to help quantify symptom severity. They also assess the impact of symptoms on daily functioning and quality of life. It's crucial to distinguish GAD from other anxiety disorders, depression, or medical conditions, as this differentiation guides treatment approaches. Many individuals with GAD also have comorbid conditions that require simultaneous attention. Treatment approaches, psychotherapy. Effective treatment for generalized anxiety disorder often involves psychotherapy, medication, or a combination of both. Let's first explore the psychotherapeutic approaches that have shown significant effectiveness. Cognitive behavioral therapy, CBT, stands as the gold standard psychotherapy for GAD. This approach helps individuals identify and challenge distorted thinking patterns that fuel anxiety while developing healthier coping strategies. CBT typically involves recognizing cognitive distortions, conducting behavioral experiments to test anxious predictions, and practicing relaxation techniques. Acceptance and commitment therapy, ACT, offers another evidence-based approach, teaching individuals to accept uncomfortable thoughts and feelings rather than fighting them. ACT helps people clarify their values and commit to actions that enrich their lives, even in the presence of anxiety. Mindfulness-based therapies, including mindfulness-based stress reduction, MBSR, and mindfulness-based cognitive therapy, MBCT, train individuals to observe their thoughts and feelings without judgment. These approaches help break the cycle of rumination and worry by fostering present moment awareness. Psychodynamic therapy explores how unconscious processes and past experiences contribute to current anxiety. By gaining insight into these underlying factors, individuals can develop more adaptive ways of managing emotions and relationships. These therapeutic approaches may be delivered individually, in groups, or increasingly through digital platforms. The format depends on individual preferences, availability, and specific needs. Treatment approaches, medication, and lifestyle. Medication can be an important component of GAD treatment, particularly for moderate to severe cases. Selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs, are typically the first-line medications for GAD. These antidepressants help regulate neurotransmitters involved in anxiety and typically take several weeks to reach full effectiveness. Buspirone, an anti-anxiety medication that works differently from SSRIs/SNRIs, may be prescribed for GAD with fewer sexual side effects and no risk of dependence. For short-term relief of severe symptoms, benzodiazepines might be used cautiously due to their potential for dependence and tolerance. Beyond formal treatments, lifestyle modifications play a crucial role in managing GAD. Regular physical exercise has been shown to reduce anxiety symptoms, potentially as effectively as medication for some individuals. Even moderate activities like walking can make a significant difference. Sleep hygiene practices, maintaining consistent sleep schedules, creating restful environments, and limiting screen time before bed help address the sleep disturbances common in GAD. Dietary considerations matter too. Limiting caffeine, alcohol, and refined sugars while increasing complex carbohydrates and anti-inflammatory foods may help stabilize mood and energy levels. Stress reduction techniques like deep breathing, progressive muscle relaxation, and yoga can provide immediate relief from physical tension. Building a strong social support network and engaging in meaningful activities also contribute to overall resilience against anxiety. Conclusion and resources. Living with generalized anxiety disorder presents real challenges, but it's important to remember that effective treatments exist and recovery is possible. Many people with GAD learn to manage their symptoms successfully and lead fulfilling lives. The journey toward managing GAD often involves a combination of professional treatment, self-care strategies, and social support. What works best varies from person to person, so finding the right approach may take time and patience. If you or someone you know is struggling with persistent worry and anxiety, reaching out to a healthcare provider is an important first step. Mental health organizations like the Anxiety and Depression Association of America, the National Alliance on Mental Illness, and the International OCD Foundation offer valuable resources, including provider directories, support groups, and educational materials. Remember that seeking help for anxiety isn't a sign of weakness. It's a courageous step toward better mental health and improved quality of life. With appropriate support and treatment, the persistent worry of GAD can be replaced with a greater sense of calm, control, and well-being. Thank you for taking the time to learn about generalized anxiety disorder. Understanding is the first step toward compassion, both for ourselves and others navigating the complex landscape of anxiety disorders.